Adam Ladell joined us earlier from Melbourne, along with the president of the Tourette Syndrome Association of Australia, Robin Latimer. Her son and daughter both have Tourette's. Robin Latimer, Adam Ladell, thank you both for joining us on the program.
Thank you.
Adam, so many people who've been diagnosed with Tourette's syndrome talk about this process and this anxiety about coming out, if you like, about disclosing their condition. What was that path like for you, particularly because you did it not just with your family and friends, but then on national TV as well?
Yeah, it was definitely a big step because when I first got diagnosed and it first started happening, I was very self-conscious about it, very anxious about it. But then, obviously I thought if I don't get the word out there about it, if I don't tell people about it, it's never going to get any easier for anyone, let alone myself. So I thought it would be, the right thing to do, the most selfless thing to do that I possibly could. So,
Robin, I know you can relate to this because you've got two young children who were diagnosed as well, and that was the advice that you got, that it's better to come out and to disclose early because your chances of dealing with the condition later on improve.
That's right. I think that was one of the best pieces of advice I received, and it was from a school psychologist who had other students with Tourette's, and my son was very young at that time, and she said, those that fared the best long term were those that were the most open, and I just put that away. I wasn't quite ready to be open at that time. I put that bit of information away for when I was ready. It was realistically 2 more years down the track. Up until that point, it was a needs-to-know basis with the school principal, direct teachers.
And what was that about? Was that about shame, or was it about not understanding the condition?
It was, for me, more about ensuring that my child was also aware and that I didn't want other people to have more information than him so that he could advocate and know what was going on as well. His self-awareness had to develop, and at that time when we did tell his whole class and start telling everybody, he was able to articulate and tell them and take ownership.
Now, there are different degrees of tics. Robin, I know your children have quite low-level tics. Adam, you're on perhaps the other end of the spectrum. What does it look like for you?
Yeah, so it's definitely gotten a bit better over the years, but during my peak was about 14, 15, 16. Swearing, racist remarks, yelling out stuff. It was absolutely torturing mentally because, you're yelling out these things in front of strangers that you don't know, and a lot of them are judging you. The physical ones especially can hurt a lot, which makes it very tiring to kind of sustain your energy during the day. But yeah, it's pretty difficult.
Adam, these tics are involuntary. A lot of people don't compute how it is that your tic disappears when you sing. How do you explain that to people?
For me, I explain it with kind of, when you're singing, anyone who sings will kind of know this, that has a real deep passion for singing, is that when you're singing, you kind of get transported into another place. You're not thinking about anything else except the song. You're focused completely on the song, and I think that's what kind of does it, because you're not thinking about anything, and the tics just go away completely. So I suppose it's a focus thing, probably.
Well, Robin, a lot of people with this condition talk about this notion of being in the zone somewhat, about being so focused that the tic goes away.
Absolutely. I use an analogy of tuning into a radio station. I think in the normal environment situations, it's like the radio's not tuned in. There's a lot of peripheral noise going on, and then when they find something that they can really hyper-focus on, it might be singing, as it is for Adam, it might be playing chess, or it might be doing maths for someone else. It's just finding that one thing that they can really succeed in and hyper-focus on. The radio tunes in perfectly and all that peripheral noise goes away.
You've actually been running a program through your association called Talent Over Tourette, which is about finding that zone, those special talents for different people.
That's right. We've got a program that you can download from the internet that was put together actually by a student for us through another campaign we had, and it's a little package you can play as games with students in a classroom, so it doesn't have to just be used with the child with Tourette's. It's beautiful because it can be used in a classroom for all children to find their strengths and where their talents lie.
Adam, tell us about where medication fits into your regime of self-care.
Yeah, so I'm on quite a lot of medication at the moment. You know, it's been a journey with medication to try and find the right combination. I mean, it took probably about 2 years to actually get the right combination, which I'm on now, which is, it's the right amount. It suppressed it enough, but it doesn't make me tired. I've had ones where it makes you depressed, it can make you restless, and at the same time extremely exhausted, so you become a complete mess, and I've done that before. But in the end, I've gotten a good combination. It's all about trying out different things. Some medications work for some people and don't for others, so it's all a case-by-case basis, but it definitely does help.
Robin, there are also therapies that don't involve medication. It's about behavioural therapy of sorts.
One of the first steps is reducing anxiety levels, reducing stress levels. There's a program called CBIT, or Comprehensive Behavioural Intervention for Tics, that has proven efficacy, and we're working with psychologists to get them trained into using this program. And anything essentially that works for you to reduce your stress levels. It might be swimming. A lot of physical activity is a really good one as well, because it uses up the excess energy that people with Tourette's tend to have. Or it might be yoga or meditation. You know, it's what reduces your stress levels for you.
Part of the difficulty here, question for both of you, first to you, Robin, that a lot of people with Tourette's have other related conditions as well. So it can be quite difficult for a medical professional to separate them and to medicate accordingly, Robin.
That's a very big issue, and in fact a lot of people when they're young might get a diagnosis for ADHD first, and then later the tics appear and they get a diagnosis of Tourette's as well, or they might have anxiety and OCD behaviours, and a huge array of different conditions. There's no specific medication for Tourette's, so what Adam said was right. It's very individual and trial and error. There is a set, we do have a medical advisor, and he has done a lot of work, and international studies have done a lot of work to give a basic plan for what to try first and which directions to go in, but it won't work for every individual. And as Adam said also, there's always some kind of side effect, because you can't just drug the part of the brain that is the Tourette's. It affects the whole brain.
Adam, how long did it take you and your doctors to work out that correct regime of medication and to give you the correct diagnosis?
Absolutely ages. I think it was, I started off, just like Robin said, kind of the exact same order. I was diagnosed with ADHD first, and then the Tourette's later on with OCD and anxiety as well. But to find the combination for the Tourette's to suppress it took probably about 1.5 years, 2 years. It was a long and tiring process. I had to take some days off of school, weeks off of school, because the medication I would be on at that time I couldn't cope with, but I had to stick with it to see if it would work. So it was a long and hard process.
Adam, you've become quite the advocate for kids with Tourette's, for people with Tourette's in schools. Not everyone finds a school environment or peers or teachers who are supportive.
No, of course. The schools can be quite a harsh place for kids with Tourette's, especially, I think, in the younger levels of school. So kind of in the junior schooling, and in high school, I think it does get better with maturity. Teachers, you get along with teachers better, they understand more. But I think the biggest thing is always letting the people around you know what's going on. Because if people don't know what Tourette's is and they don't know that you have it, they're obviously going to make fun of it because they think you're just messing around. So it's always best to kind of get it out there.
Robin, it's been part of your work to reach out to schools, to teachers and principals, and also to GPs to help those with the condition, whether they're diagnosed or not, because they're often the first line of diagnosis of a person realising that they are dealing with this condition.
Absolutely. Schools, it's our philosophy, if you can reach one teacher, you're reaching how many children. If you can reach one GP, you're reaching how many families. And teachers are often in a very good environment to be able to recognise when something is out of normal behaviour or out of normal range, when perhaps parents aren't, if it's their first child. So quite often the schools contact us directly for support and help, and we help them with how to approach the family, or it can be vice versa. But there's a lot of accommodations that can be put in place. There's study plans, there's just some really basic, simple things about education for other people, little things like they might be safe in the classroom environment, but the issues might arise when they're in an unstructured environment, such as in the playground. So they need to be aware that when the child's out of their care in the classroom, can someone be watching them in the playground or keeping an eye out as well?
The online space is a great way to reach out to people, you know, when you're talking about a community that's spread all over the world, all over Australia. Adam, you've got your YouTube channel, which has been incredibly successful, and you try to contact young people and to lift them up and to be positive about their condition and to be comfortable in their own skin. You've been a victim of online bullying yourself. What's the best advice you give people about dealing with this condition and responding to that sort of negativity when it comes their way?
You know, this condition is definitely seen as, there's comedic values to it as well. You know, it's been seen on TV as kind of a comedy disorder. People think of Tourette's as, it's funny. And I agree it is funny, but the problem is that some people will take it a bit too far. And the one thing is, everyone with Tourette's will suffer bullying. It's a given. Until education gets even higher, everyone's going to suffer it at the moment. But the thing is, education, we need to actually tell people what it's about. And also, don't take it to heart too much, you know, embrace it a bit. For me, I was really upset by it, really anxious, and that sent me into depression because of it. But once I started to embrace it and see the light side of it, see how you can help other people with it and, you know, inspire people, it honestly, it makes a huge difference.
There's a great lesson in that for all of us. Adam, Ladell, Robin Latimer, thank you both for joining us.
Thank you very
so
much.
Adam Ladell joined us earlier from Melbourne.